Welcome, colleagues, to part 4 of the CE Certified TikToktivity series from MLI. I'm Dr. Lauren Powell, and we will discuss how to appropriately evaluate the efficacy and safety of the newest game-changing therapies to optimize clinical outcomes for patients with symptomatic anemia and LR-MDS. You know, like I know, that PCPs are the quarterbacks of the clinical team. You are the experts managing comorbidities like diabetes, hypertension, and heart disease. But are you comfortable in treating those same comorbidities once a patient has been diagnosed with LR-MDS? Red blood cell transfusions may temporarily alleviate the symptoms of anemia, but will over time lead to iron overload, possible sensitization, and potentially lowering the effectiveness of subsequent therapies. While red blood cell transfusions quickly eliminate the symptoms of anemia like fatigue, weakness, shortness of breath, the effects of the transfusion wear off and symptoms can return if the underlying cause remains untreated. Early introduction of erythropoietin-stimulating agents, or ESAs, or newer emerging treatment options may impact the disease's clinical course and improve the quality of life for the affected patients. Patients who do not respond well to standard therapy should also be considered for clinical trial enrollment in collaboration with their hematologist. The NCC guidelines talk more about this in detail if you're interested in learning more about when a given patient should consider being enrolled in a trial. As PCPs, we should be familiar with a short overview of dosage and safety management of some of the approved therapies for patients with symptomatic anemia and MDS. The package insert for each drug provides more detailed information. Also, check out the resources in this video for additional readings and data at a glance. Epoetin alpha and beta, several biosimilars, and the longer-acting darbepoetin have been the mainstay of treatment for anemia in patients with LR-MDS. Potential risk of these agents include thrombotic events or transformation to AML. Medication side effects can and should be monitored and managed by the PCP as you continue to see patients in clinic for other comorbidities. It's especially important to be cognizant of the contraindications, if any, or other serious adverse events that may impact treatment decisions. For some therapies, the contraindications are minimal, such as luspatercept, which has none. Check out the downloadable resources for more information. For patients with symptomatic anemia requiring second and third line treatments, recent studies have shown that clinical benefit for patients with LR-MDS with low dose azacitidine or decitabine. Promising therapies include imetelstat. Recently published data from the EMERGE study revealed that 40% of patients on imetelstat became transfusion independent after 8 weeks, and the transfusion independence lasted for more than a year, with the most common grade 3-4 adverse events of neutropenia 68% and thrombocytopenia 62%. Thanks for joining us. I'm going to page to the next doctor to bring us over to the finish line with the last video of the series. To watch now, just click the tag in my caption. To get credit for this activity, don't forget to answer the questions on the link below.